sexuality is the best topic in medicine to make sure why integrated medicine is so important if you really want to have a holistic approach. Because, you know, the patients don't realize that they've had, for example, a trauma, or they have a problem with the relation to their wife they're in at the moment, or they don't sense that there is, you know, cardiovascular disease, which brings them high blood pressure and makes them feel dizzy. But in sexuality, if that doesn't work, you know, that's a strong issue. And this is very often the first, how do you say that, the first moment when they start realizing there is something wrong.
I'm Paul, founder of Manifesto. CORE is our online mastermind network, and this video is recorded live during our weekly community meeting. If you like it, then subscribe and check out our website if you'd like to join the next community meeting held every Friday.
Welcome, Dietmar, to being on the spotlight for our Friday meeting here this Friday.
Thanks, Paul. Thank you very much.
Good. I'm going to do a little introduction to you, because this is also getting recorded for our podcast, because you're a man on a mission, as far as I can see it, which is the kind of guy that I've really appreciated seeing coming in here in Manifesto. You're a qualified doctor and a urologist. And I just noticed, as soon as I've been speaking to you, this passion and this energy and this drive as far as engaging in the kind of stuff that we're doing here in Manifesto. So you're coming to the European Men's Gathering this year and doing a workshop there. You're going to Mannheim in Berlin this summer and going to be up and giving a lecture there as well. And are really fully engaged on a number of levels, where what I really see is you're taking your work and you're noticing, like, there's some things that the system and, you know, the public healthcare isn't addressing, and so you're lifting your eyes a little bit and looking like a little bit further out and saying, well, how can we be doing this? And, you know, so you kind of like ambitious in a way of, like, you know, solving some big problems, but also looking to engage with other people and collaborate with other people to be able to realize, like, you know, some bigger stuff that one can do by oneself. So yeah, I'm really happy to be having you participating on that. And today we're going to talk about sexuality, because this is something that many men struggle with. You get to see that as a doctor in your practice. And obviously this is a taboo subject, which guys probably have a really hard time just talking about with their doctor, let alone in the public sphere as well. So we thought we're going to start off with you kind of giving us a little bit of insights into what you've experienced and seen through your work, and then lead that into a bit more of an open discussion. So yeah, over to you, Dietmar.
Paul, thanks very much. That's what I call an introduction. Perfect. Thank you. But I'll give some credits back to you. It's always good to be here on a Friday, and usually it's the other way around. I sit and listen and learn. And today I'm in the presenter's seat, so I'm pretty happy to contribute to the work that you've started with Manifesto. Once again, thanks for giving me the opportunity. Now, we've been talking about sexuality the last couple of weeks here on Manifesto, and we've had various presenters here who were all kind of specialists in the field they're dealing with, and they all had different opinions. So what I learned so far is there's no clear answer to the question, how do we approach male sexuality, and how do we deal with that? And the other thing that's quite obvious, it's important enough to get everybody, make up a mind on that. Everybody who's working with men really seems to have an opinion about how to approach male sexuality. And today I'd like to share mine with you. As you said, Paul, I'm a urologist, and I specialized in andrology over the last couple of years. And I'm also a trained psychotherapist for men in sexual disorders. So I'd like to share my opinion about how to deal with these problems. And first of all, I'd like to give you some facts that I think are really interesting to start off with. And I'll share my screen. So sexuality in men. We were talking about the question, is it really that important? Well, it seems to be. This is a study that's been launched by Pfizer, the drug company, when they started their promo tour after just putting Viagra on the market. And that was the time when really nobody talked about sexual dysfunctions. And they were asking all over the world, how important is sex to you? And this is just the result for the question, it's extremely important or very important. Well, the Brazilians are first, but you can see all over the world, really, it seems to be a topic that's important as well for men and for women. Now, we're talking about men, so that's an interesting study. I'd just like to give you an idea about how do men behave and how active are they? The question here is, did you have any kind of sexual activity in the past 4 weeks? That's a multinational survey, and that's been done in 7 countries of the world. And the total number of men who just said, yes, I was sexually active was 83%. And if you look at the subgroups, the 50 to 59-year-old men, it's 92%. So it's quite a big topic for this age group, but still, look at the column on the right side, the 70 to 79-year-old men, still around 2/3 of them are sexually active. And this is exactly my experience in my office when I see men. Sexuality is always an issue, no matter how old they are. Another question that we were talking about is what drives us? So why do humans have sex? And this has been under review as well. This is a study where they were just looking into various studies that have been performed about sexuality and just looked at the reasons why people have sex. And they found 237 different reasons. And there was a huge range for why do we have sex. It was from pure pleasure to something rather spiritual, where they said, well, it makes me feel that I'm closer to God and I want to have this experience more often. And then they determined subfactors and tried to find a hierarchy. And there were 3 subfactors. They were physical, goal attainment, and insecurity. And the physical ones were stress reduction, pleasure, desirability, and experience seeking. And if you look at the goal attainment one, I found that really interesting. It was resources, to build up resources, especially in the younger groups. It was related to social status. So if you had sex, then you were one of the guys. If you don't have that, it seems to be a problem. And then there were quite a few saying, well, it's revenge. You know, my partner cheated on me, so I want to do it back to him or her. And the third one, insecurity. So the reason was to give yourself a self-esteem boost, or people felt it was a duty or pressure in order to keep the relationship going. So when you look at the studies, and this is only a few because of the time that we have here, I'm just picking those studies. Male sexuality seems to be an expression of your status, of your body, your mind, and your soul. So it really relates to how you see yourself and which way you behave. And from my perspective as a urologist seeing people with disorders, I turn it around and I'm trying to approach sexual dysfunction as a mirror of the state of the physical situation, the mindset which is behind this dysfunction, and the situation the soul you're in, or your soul is in. And that's something which is really common. This is a classification of male sexual dysfunctions. I'm not going to go through all of them. There's a lot of literature around there, and you can talk to your urologist about that. The ones which are pretty common is erectile dysfunction, and you might have heard about premature ejaculation, and that's even more common than erectile dysfunction, but nobody really talks about that because the treatment is not as well established as in erectile dysfunction, since we started the PDE5 inhibitors like Viagra and the co-drugs that are available on the market. And this one is important, and that really made me realize why we have to do a wider approach than just a physical one, because male sexual dysfunctions are really just the tip of the iceberg. You have a 2-fold higher risk of receiving myocardial infarction. It's related to depression. You'll determine hormonal dysfunctions, endocrine diseases, hypertension, psychological trauma, which is either caused by the dysfunction or which is the reason for the dysfunction. So it's a huge field where you can really find very, very interesting reasons for what's going on. So my approach towards sexuality in men is, of course, medical evidence-based, and I'm a scientific-based trained person as a doctor, and I think this is really important, and we can do a lot of good therapies for people. You know that I'm, for example, putting penile prosthesis, I'm putting in penile implants in people after trauma and people who've had surgery and just can't have any erections anymore. But the medical approach is not the only way of dealing with those problems. And I'm not going to go into details here because, again, you can find a lot of literature about that, and you'll be able to talk to your urologist if you want to go deeper here. The other one, which is evidence-based as well, but not as general as the physical approach or the medical approach, is the psychological one. Let me just quickly give you an idea why. When we say your sexual behavior mirrors the way your mindset is and the way you behave and interact with other people, it's part of your personality. And we all know that genetics is only for about 50% responsible for who you are. And the rest is determined by what we call environmental impact. So in the early stages in life, we have three passages which are really important, and you're really vulnerable there. It's the first 3 years when you learn early binding, security, love, and in the best case, you have your parents who will offer that to you. Year 4 to 10 is when you consolidate what you've just learned. You start interacting with other people and you develop physical and mental experiences. And after that, when you've started that and you're pretty much established, you start your first revolution and you start to disconnect from the subjects that you've just built in your surroundings. And this is when you have trouble with your parents and you're revolting, with the result that you come back and you build a new relationship to those people, which is then driven by your own personality. So giving that, you will have impacts for the first 20 years. And after that, you will be a person which is full of reactive patterns and personal perception patterns on sexuality. That's not only the case for sexuality, but as we talk about sexuality, I think this is important to highlight in here. And there's a third approach, which I feel is really important. And I call that spirituality. And I have a tool that I'm using when I talk to men about these things, which I call circularity of life. Now, this is not something that I've developed for myself. I've just changed it a little bit. That's been very much influenced by the work of Bill Plotkin. You might have heard about that guy. If you don't, I recommend to read a book called Soulcraft. You will then understand what I'm talking about. And the subject of circularity of life has been experienced by myself when I was working with the Franciscan monks, with Richard Rohr, and a German guy called Jan Frerich, who's been bringing this into life. And that's really influenced my work in medicine as well. Now, spirituality, let me just clarify that. I'm using spirit, ego, and soul, and I want to make sure that people understand what I'm talking about when I'm using these words. The ego is quite often misunderstood. I'm not talking about a negative connotation when I'm saying ego. We all know, oh, look at this guy, he's a blown up ego. What's he doing here? This is not what I mean. The ego, in my perception, is a result of an influenced personality that's developing all the time, and that can be seen by people you're interacting with. So this is basically what you show when you live your life connecting to other people in society, being a father, being a husband, and so on and so forth. And the psychological impact I've just mentioned, but there's also something which I call the spiritual or spiritual impact. This is what I've experienced for myself and with many clients I'm working with. Sometimes we feel related to a big group, a community, to other people, and there is something that really binds us together, but we can't really put it in words and we can't really grasp that, but it's something that we experience, and that influences us. And that's the case in various phases in life, in different stages, but it's something that really is important for your personality. And the other one is soul. And when I talk about soul, I'm thinking rather in categories which is really unique. So there's something which is really grounded in the subconscious area of your life, which is unique, which is something that only you can have and that only you can share and give when you live your life in society. So I just wanted to make sure that you know what I'm talking about when I'm using these words. Circularity, that's something which is probably known to you. And I'm talking about stuff that's coming from ancient people, where they say, well, look at that, the whole life, the whole system is running in circles. If you look at the sun, for example, at least in the northern hemisphere, it'll rise in the east, it'll be on top in the south, it'll go down in the west, and you won't be able to see it up north. And you don't have that only on the day, but you also have that with the seasons all over the year. You'll have winter, and after winter there's spring, then summer, and then you have autumn and back to winter. Now, the important thing about that is, I'm trying to go into details a bit more, but the one thing I want to make sure now is you always have to stick to that circle. You can't just jump from winter to summer or from spring to autumn. You always have one thing that's dying before the other one will rise, and then you will follow that path into the next stage. Now, there's been a circular personal development, and you might have noticed that I've changed the circle. I put south on the top, and this is because I really like the image that, in south, the sun is really high. It means it's warm and it's joyful, and you're really happy when you're out in the sun. And if you look at the personal development, the southern criteria will be something like joy, childhood. When you're really playful, you follow your instincts, you realize the physical experience, it's the body that you follow. And if you follow Jung, he'll put the archetype of the lover down south. Now, the Western quality is when you experience youth, when you're growing up, and then you learn to distinguish between yourself and the others, and you try and find your place there, and you realize that there is the psyche which is probably playing wild at that time, but you try and develop your personality, and this is following Jung. This is rather the archetype of the warrior. The northern quality, this is the pure adolescence. This is when you take over responsibility. You will have learned that you have to do stuff even though you don't like to do it, but it's important in order to receive more qualifications and to carry on with your career and so on and so forth. And that equals the archetype of the magician. And if you go to the east, it's the state of the elder. This is where we talk about wisdom, when you have established a connection to spirituality, when you realize what your quality is. That's the quality of the soul. And if you act that out in your community, then it's rather following the archetype of the king. Now, this looks as if it's only one passage in a lifetime, but the idea about what we're talking about here, the circularity, means you're always doing that. You're always circulating around. If you, for example, find a new job, well, then you start up in the south. It's nice to be there. It's the next step in career. You follow your instincts and check out the mates you're working with. Then you pass on over to the Western quality, because then you realize who is in which position, how to behave with whom. And when you carry on, you end up in the north. You will then have established your knowledge and your position in this new job and can move on farther to the east, and then you probably be the one who's teaching the next young one who's joining the company. So what I'm trying to make sure when I talk to patients about that, there's always the circularity, and it's healthy. If you look at the picture before, when I just mentioned that, there's the small ego. But if you want to develop that, then you have to carry on in circles, and you'll gain more experience, and there'll be more satisfaction, and you'll have a stronger ego in the sense of you can really interact well with your surrounding, and you make sure who you are, what you want, and people will sense you as a strong person. If we break that down to sexuality, the quality up south will be something like instinct. You just follow your basic instincts. You make your first experience, and you really like that joy. And this is, once again, remember, this is the quality of a lover. If you go to the west, it's more like you know who you are, you know what you want, and it's down to satisfaction. It's down to domination, creation. We talked about that early on. This is when you start realizing that you're in the position of, making kids, basically create new life. What I realize when I see patients who are kind of stuck in this area, there's a lot of fear coming up, because it's the main thing that you really have to be sure that you perform well in is have a good erection, make sure that there's a strong ejaculation. So that's the warrior type of sexuality. When you move on and you look at the quality of the northern hemisphere, then it's more like giving and receiving. So this is when you take responsibility not only for yourself, but you look after your sexual partner, and you sense what he or she wants, and you'll be able, because you have a lot of experience, that you give to him or her what she likes in order to raise the quality of the sexual interaction that you have with this person. And if you move on even further, it's something that I call sex as oneness, or soul sex. This is the king archetype. But that's what people, what we've been talking about when you try to establish an energetic experience where you're not only just acting out in sexuality, but when you try and bring yourself and your partner into a situation where it's full of energy, and it's not only just the sexual act. So here again, the perception is, and I'm really convinced to the marrow of my bone, you have to go through the different phases in order to make the experience. And the more you carry on doing that, the higher the quality of sex will be. Now, when I see patients, for example, with, well, we can talk about that in a minute. Let me just clarify again. If you imagine just not only being on in a circularity, but imagine you're on a platform which is floating on the sea, and this is the shell you're on during your life. This is quite convenient the way he is here, but if you imagine you have those qualities of the southwest, north, and east qualities, and if you're based in the middle and you can be part of all of them, then you're pretty safe. But just imagine the guy standing up and just going to the west and staying there all the time. He'll tip. And this is an image that I use when I try to explain what happens when you're stuck in your sex life, and you always stay, for example, in the Western area, and you think that sexuality is something about satisfaction, strength, erection, ejaculation. And then you probably realize, well, my problem is I don't have an erection, and this is why my sexuality doesn't work anymore. Okay, I hope you understand the concept, and I could carry on with some examples, but Paul, I think time's up to get back and probably do some Q&A or discussions.
Yeah, thanks, Dietmar. That was super interesting, really broad for a 20-minute introduction. But I think you really covered a lot of good bases and set it up really well for a good discussion. There was two things that I thought we could just go into in plenum here. And then if there's one guy who wants to ask a question in plenum here as well, then we can do that. But the question, one of the things you said that really kind of pricked to something in me, you said something like, sexuality is the tip of the iceberg.
Right.
And I notice as well, like, when I'm just a little bit emotionally unstable, the first thing I notice is like the way that I try and deal with it is like some more intimacy with my wife, or just like to get off with my wife or something like that as well. And so I think that's kind of like, it is like that fine needle to be able to detect sometimes a little of instability or something like that. But could you say a little bit more about what you think about, that sexuality is the tip of the iceberg? Is that also just regarding health issues?
Yeah, it's regarding everything that, including what you've just mentioned. What I was, when you come from the medical point of view, and I've been talking about the integrative medicine earlier on when I was here to present. Sexuality is the best topic in medicine to make sure why integrative medicine is so important if you really want to have a holistic approach, because the patients don't realize that they've had, for example, a trauma, or they have a problem with the relation to their wife they're in at the moment, or they don't sense that there is cardiovascular disease which brings them high blood pressure and makes them feel dizzy. But in sexuality, if that doesn't work, that's a strong issue, and this is very often the first. How do you say that? The first moment when they start realizing there is something wrong. In the case that you've just mentioned, when you feel a little bit unhappy and you want intimacy with your wife, there's a pattern behind that. And this is what I'm trying to say here. There's a pattern which is behind the situation, and if you go deep and look into that pattern and try and realize what's going on, which is always coming back, then there's the key to improve on that one. And sexuality really is the tip of the iceberg regarding medical diseases. We've had people presenting with erectile dysfunction who've had cardiovascular disease and didn't know about that, for example. But you also have problems with the personal development and the sense of your own personality with regards to what I mentioned in spirituality. So there's this discomfort, but there's a huge thing behind it. Okay. Does that make sense? Did you?
Yeah, it does. So for me, there's kind of like a doubleness, and especially related to the circle that you had of development. I wonder, maybe you can bring it up again. But what I was wondering is you put in the middle of that circle, you said better sex. and so in some ways what I see is that, our sexuality is a tool and a source of energy. It's the libido. It's that which kind of like, can be used to channel our energy in some ways. But there's also a real tendency amongst men to see sex as a goal in itself, and especially really good sex to be a goal in itself. And I wonder, is this a little bit of a distraction, to think like, okay, well, I need to go around this circle and make sure I get the best sex possible. But at the end of the day, a man who's having great sex but has nothing else in his life, doesn't have good relationships, doesn't have a purpose, doesn't know why he's doing his stuff, that sex is going to be very, very boring for him as well. And just to ask as well, so one thing I felt lacked a little bit in maybe especially the West and the North, was something around creating children. Because at the end of the day, like I would say, and this you could discuss this, but I would say, to separate sexuality from the act of creating children with a woman and creating a family, it's a very unnatural state of being for human beings, given that the whole sex, what do you call it, birth control is such a new technology, right? That hasn't in any way influenced our actual psychological being yet.
Yeah, but I do entirely agree. Maybe that's a misunderstanding. I was trying to pinpoint on people who present with a disorder, who come and have some complaints. If you have good sex and you're happy, I don't care what you do, and you don't show up to see me. But if you have a symptom, then it's as I said, being the tip of the iceberg. The symptom itself is not the key towards the solution. You have to look, behind it and try and open a channel for the one who's presenting towards me to follow me into that one in order to make sure that we get towards the area where the problem lies. But of course, which I said here, creation is something we were talking about earlier on. That's important, and that really helps men to feel they're strong and they're, in the middle of the power that they can give. But still, if you have problems at that stage and you feel you want to but you can't, and your erection goes down, then it's very common that I check them medically and they're completely healthy. There's no underlying cause, and then it's interesting to check out why those gentlemen don't have a proper erection.
Yeah, and it could be that they actually, life is kind of saying to them, like, you need to be going to the next step in the circle, and they're not really ready for that in their own mind yet. But that's what comes up for me, I think, right?
Yeah, that's right. Yeah. And if some come in and just say, well, I want this, I've read a book about soul sex, and then we need to make sure where they are at the moment and how to establish the next step. How do we get towards this?
Yeah, that's a really great point as well. Yeah, that you as you started out by saying, like, you can't just jump. There are certain patterns of being.
Yeah, that's right.
I loved your framing of spirituality with that. There are these cycles. It was so basic, but it's such an important thing that I think so many people forget all the time. Like, there are just certain ways that things happen in life, and this is the wisdom of the ancients in some way.
That's right. Yeah,
which I think that Bill Plotkin also puts across very well. Good, guys. I'm not seeing any hands up, so. I'm gonna. There we go, Floris. Let's hear from you, man. You're still muted.
Yes, and I obviously need to get myself in. Oh, there I am. Dietmar, amazing presentation, and thanks. I really liked it. The question for me is because I can relate to it, and when I first saw it, and also in other areas, for example, menstruation cycles or moon cycles or whatever. I find the visualization of it, the whole process, I find it beautiful because it really brings back to the ancient of, obviously spring is turning into summer, which is turning into autumn, which is turning, and you can really bring it back to yourself quite clearly, unless obviously you have seen Monty Python, then winter springs into autumn, but that's not my question. My question is, when people come into your practice, for me at first, seeing actually like there was a cycle of menstruation or a cycle in season, a cycle in your own personal development, I was like, what do you do, or what happens? What do you do to bring it clear to them? Because it's like, cycle. I just want soul sex and I want it now.
Yeah, there's maybe I can give you one example, which I think is interesting because we were talking about that in the earlier meetings as well. A really good one is the young guy who comes in. I've had one recently, and I see them quite frequently. That guy presented. He was like 22 or so, young man. He was at university studying economics, good-looking guy, well in shape, fully trained, everything you would just need to say, well, that guy really is a womanizer. And he told me he wanted me to check him over because he said there must be something wrong with my hormone state, because I go out with my friends, I see a woman, we get in relationship, but as soon as we're getting closer and there might be the idea that it's coming down to sex, I back off. I can't do that. Now, this guy was obviously fit and well, healthy. And when we talked about his life and his sexual experiences, he told me that he's watching porn every day. And he's just, he's abusing this. And he was the one who was full of energy, and he just needed a relief for that one. And for him, it was really helpful when I asked him, did you have anybody who's teaching you, who give you an idea about how sexuality works? At home, his parents didn't care about that, and he was kind of left alone. Being a young boy, he didn't really have caring parents, and the only way that he started learning about sexuality was via the internet and watching porn. Now, obviously, I can tell him don't do it, but he wouldn't. He's okay, I don't want to do it, but I don't know why, and I can't really sense why I should stop. When we looked at the circle, right, in the southern part, he was, when I was young, I had my parents, only for a couple of times, but then after that, nothing happened. I moved on to the next step, which is where I experienced this, a strong erection, a strong ejaculation, and I was watching porn, but I was stuck there. There was a huge border there, and he was willing to go on because he had friends around him who had girlfriends, and they started thinking about family and stuff like that. And he was really, that's when he just realized that there's a strong desire to cross this border and carry on towards the next level. And that was something that he kind of experienced again very deeply. And this is what I'm saying when I think there is this spiritual thing. That's the knowledge of the ancient people. There's something's grounded in us as well. And if you can relate to that one and you can touch on that, there is a deep understanding. And this is what really helped the guy. And we then start developing programs, and it's going too deep maybe for the moment, but this is how you really get people to relate to this ancient knowledge, where they say, yes, I can understand that, and I really sense the truth about that. And then they're willing to make the move.
Yeah, thanks.
Thanks, Forrest, and thanks, Dietmar. And I think that's really illustrative of the approach that you're taking to medicine and your practice with really seeing the whole human being. and there's this tendency that I feel very frustrated going to the doctor here in Denmark very often, because they're just focused on relieving the symptoms, like if it's itching somewhere, then you get this cream and then it'll stop itching, right? And no questions about like, well, why? What is so I think it's so encouraging to see a doctor who's really exploring this and implementing it, and from what I understand, also working with in the field with a lot of other people who are doing the same thing as well. So great. We're going to hit stop for the record. I guess there was a link on your slides there. So is that where people can be finding more information about the work you're doing?
Yes, they can. Yeah. Yes.
Yeah. Good.
It's
so we'll
German,
put that in the link of the video as well.
I'll work on that, so it's international. At the moment, it's only for people who are able to read German.
Yeah. Otherwise, Google translates.
Yes.
Yeah. Okay. Good. Thanks, Dietmar.